Hello, everyone. Thank you for joining us today as we discuss a topic that we believe is one of the most important issues in public health today. As Brandon already noted, my name is Andrew Twinamasiko. I'm a staff attorney at the Public Health Law Center, and I'll be moderating this discussion. As the title of the webinar suggests, today we'll be discussing the legal doctrine of preemption in the public health arena. Preemption manifests itself in many ways and in many areas of public health, and we can talk about it for days and days. Today's webinar, however, is meant to be a primer on preemption, highlighting its role in public health. If you need more information, we have resources on our website discussing preemption extensively. And I'm happy to let you know that CLE accreditation for this webinar is pending approval. We have a wonderful panel of public health experts who will be taking us through the discussion of the legal doctrine of preemption. First, we have Cathy Callaway, who is a director of state and local campaigns of the American Cancer Society Cancer Action Network, or ACS-CAN. And we have Mark Meany, who is the lead senior staff attorney for technical assistance at the Tobacco Control Legal Consortium, a program of the Public Health Law Center. And we have also Julie Ralston Aoki, the director of healthy eating and active living. The shorthand of that is HEAL, a program of the Public Health Law Center. Just a brief overview of the American Cancer Association Cancer Action Network, or ACS-CAN. It's an affiliate of the American Cancer Association, Cancer Society, and it's a nonpartisan, nonprofit organization that works to support evidence-based policy and legislative solutions designed to eliminate cancer. And for those of you who do not know the Public Health Law Center, we are a nonprofit organization as well, located at Mitchell Hamlin School of Law. And as that picture wonderfully captures our location in the warm city of Winterfell in the north, AKA St. Paul, Minnesota. We provide a variety of services generally referred to as legal technical assistance on both the national and local levels to health departments, health advocacy organizations, attorneys working in public health issues, and community coalitions. This encompasses legal research, development of policies, and how they can be effectively implemented and defended. We have publications on a variety of issues, and we also do trainings like this webinar. What we don't do is those items in red, direct representation, and lobbying. So I'll give you a brief overview of the agenda today, which is the first thing we'll discuss, really preemption, overview of preemption, what it is, then why it matters, and then we'll transition into lessons learned in the healthy eating and active living arena, and then go on to discuss what's happening currently across the board, and then give ideas on what localities can do to counter preemption. And then, as Brandon already mentioned, we'll leave up the questions to the end, but we're saving time for that too. So I'll go ahead and let our first presenter talk about preemption.
Great. Thank you, Andrew. And thanks to all of you for joining us this afternoon to talk about what isn't always the most exciting topic, but it's one that we think is extraordinarily important for all areas of public health. Preemption is sort of this public health epidemic that will not die. It was something that the tobacco industry used very effectively for many years in the 1980s and 90s, and then we saw a little bit less of it, and it's really somewhat of a latency period, and it's come back in full force and has really expanded to encompass the whole gamut of public health and beyond. At its core, preemption is really a pretty simple concept, But it gets a lot more complicated in practice, and we'll talk more about that today. But basically, the idea of preemption, which is really at its core comes from the Supremacy Clause of the U.S. Constitution, is that when there is a conflict between a higher authority of government and a lower authority, that the higher authority will supersede or preempt the lower level. So if there's a conflict between state and federal law, that the federal law will override the state law, and similarly at the state and local level, typically the state law will override the local law. But preemption, beyond that very simple explanation, it comes in all sorts of different shapes and sizes, and we're going to talk a little bit about why it's so important for public health specifically. And it's also important to know that preemption can come from constitutional law, from statutes, and it can come from administrative agencies as well. So, for example, if there's a administrative law from the FDA, for example, that would override state and local laws. So it can come from different areas of jurisprudence or of law. Go on here. Now let's talk about why it's so important. And this is something that Justice Brandeis recognized the importance of state and local policy more than 85 years ago. He was Supreme Court Justice, and he talked about, he described state and local governments as the laboratories of democracy. And in part, that was because of their ability to have more flexibility in establishing new innovative policies, to tweak them to they're closer to their constituents. And so it was a lot easier to establish new policies and to understand the importance and to kind of experiment at the local level than it was at the federal level, which moves at a much slower pace. The implications also were less broad too when it's at the state or local level. President Obama also understood this in the context of public health, understanding that state and local governments have been historically much better at protecting the health of their constituents than has been the federal government. So we've known for many years the importance of having this ability for state and local governments to establish new and innovative policies that then can be move upward into the federal level.
Hello, everyone. This is Julie. And again, I also want to thank you for joining us today, and I'm really glad to be here. Just continuing on this theme of why preemption matters and why local public health in particular, or state and local public health authority matters. As the quote from President Obama reflects and Mark talked about, the state and local governments have historically done a lot to lead the way in pioneering public health efforts and inspiring, showing what can be done and what an impact it can make, and then inspiring higher levels of government to do the same. And so, as this quote reflects about the importance of local public health in particular, local public health also has played a very important role in sustaining local public health efforts. That's where movement building happens. And of course, it's really hard to have a movement around something if you don't have local authority. And so that's why preemption of this local authority is really important for public health, not just at the local level, but at all levels of government. Another aspect of the importance of public health, of preemption and the impact on local public health is the role of local public health in addressing health inequities and pursuing our goal of achieving health equity for all peoples across a community. And preemption, what preemption says is that a one-size-fits-all answer is what we need. And of course, with working on inequities, we need tailored solutions. We need to be able to come up with tailored approaches that are meant to address the unique needs of each community. And a preemption approach does not allow for that kind of a tailoring. So, for public health, where social justice and a focus on equity is so important, preemption is an especially poisonous pill.
Hello again, this is Mark. One of the ways I think that to understand the importance of a particular policy is to watch and to understand how vigorously it's pursued by those who have a vested interest in that policy. And so why do the industry groups care so much about preemption? In some ways, and we have certainly seen this from the tobacco industry, how strongly they have pursued this. But in some ways, it's really an issue of economies of scale. Industries and the tobacco industry specifically, long ago, they're always very forward-thinking, unfortunately. Long ago understood how difficult it was to oppose laws at the local level. There were too many local communities who were doing too many different things, and so policy was, as we said, would then percolate upwards. So it was much easier to focus on the federal government or at the state government to establish preemptive laws, which would then inhibit the abilities of state and local governments to pass progressive and innovative public health laws. This obviously became very evident, as you can see from the quotes here, as we learn more from the internal industry documents from the tobacco industry. And this playbook we've seen, while these are 40 years old or so, this same playbook has been used by other industries as well, and it continues on today.
Yes, unfortunately, we haven't had a lawsuit similar to the tobacco industry lawsuits, giving us access to a bunch of inside industry documents in the food world, but we certainly see many of the same strategies being used.
Absolutely. So now let's talk a bit about the different types of preemption. And that can be a little bit confusing because people talk about preemption in a lot of different ways. And I try to simplify a little bit by just looking at kind of two different issues. Whether the first is, whether there is preemption, is language very explicit, or is it more ambiguous whether there's preemption? So preemption, yes or no. And then the second question is, if we do know there's preemption, what's the scope of that? And that can vary quite a bit depending on the answer to the first question. So the most obvious preemption is this express preemption, where there's language in the law that makes it very clear that in this case, local governments don't have the authority to regulate in a particular area. So the first law is from the state of South Dakota, where it just says the legislature is exclusive regulator of all matters relating to the use of tobacco products. It's pretty evident that local governments aren't going to have the authority to regulate. So yes, preemption. In this case, unfortunately, it's very broad.
Yeah, and the second example is from the healthy eating policy world, and so it's an example of a Utah law that is essentially, seeking to preempt any kind of local menu labeling type law, and so it has, very clear language that a local government can't regulate the dissemination of nutritional information or what's required to be disclosed on a menu or a food tag by a restaurant or similar kind of food facility.
So when sorry.
Hi, everyone. This is Cathy. Nice to be with you all today. Here are a couple recent examples. Sugary drink taxes continue to generate preemption buzz. The top bill from New Mexico was from last year, and it clearly states that no municipality may impose an excise tax relating to tobacco, liquor, food or beverages, motor fuels, and motor vehicles. So this one was real interesting in that it covered all of these issues. And then the second one here is from Illinois, and this is currently a bill that's still pending, and it clearly states in part that no home rule county may impose a tax on sweetened beverages. So again, some recent examples of express preemption.
Sometimes we see, so those are some good examples where I think the scope is fairly well articulated in the law. We do know there's preemption, and we kind of know what it includes. We're seeing a lot more variation in that there might be express preemption, but it's not exactly clear what local governments can or cannot do. And this is one example. So before the deeming rule and before the federal government established the minimum legal sale age for e-cigarettes, most states were taking that initiative and taking that step themselves. And this is an example from Missouri, where they defined them as alternative nicotine products, and they basically had a law that I think everybody thought was the first part at least was reasonable and made a lot of sense, prohibiting the sale of e-cigarettes to those under the age of 18. But then they also added on this preemptive language that doesn't really even relate to youth access, or doesn't all relate to youth access. where it basically says that they can't be otherwise taxed or regulated as tobacco products. And so it's not clear what this even really means, whether that means that they have to be taxed, they could be taxed at the same rate as tobacco products, but defined differently, if they could be, if they can't be, considered tobacco products in the tax law, and then what it means to be regulated as tobacco products. Again, that doesn't, it's not clear what the scope of this would be, and we don't yet know because there hasn't been any litigation on this, unfortunately. So this is one of those laws that in the youth access law, part of it is really good. There's express preemptive language. We just don't know yet what the scope of that will include. We've also seen just recently existing laws that are kind of reinterpreted. In the early 1970s, some states established Asian majority laws or amended them so that and this was at the time when the federal government changed the voting age from 21 to 18. And so states, including Michigan in this case, amended theirs. And so in Michigan, basically the law says that when you're at the age of 18, you can do those types of activities that adults can engage in. And it included a reference to the statewide minimum legal sale age for tobacco products as well, and lowered that at the time as part of this. As the Tobacco 21 movement has begun around the country, we saw Ann Arbor initially was the first community in Michigan to pass the Tobacco 21 law, and then after that, Genesee County enacted one. And if you're familiar with either of those communities, you probably know that Ann Arbor is where the University of Michigan is located, which is a fairly affluent community, versus Genesee County, which is the county seat is Flint, Michigan, which has as we all know, its own public health issues and is a less affluent community. And so the industry decided to sue there in Genesee County in the Flint area to say that this was preempted by the age of majority law. And this was the first Tobacco 21 lawsuit. And I want to make sure to emphasize that Michigan's age of majority law, a lot of states have them. Michigan's is much than most others, but this law is still pending. But it's also resulted in the Tobacco 21 law not being implemented yet. So we're still kind of waiting to hear what the outcome of this litigation will be. So those are some examples of express preemption, and now we get to the area where it becomes a lot more, I would say, nefarious, because when there isn't any real clear language to show whether or not there's preemption, it's even harder to know, one, whether it exists, and two, how wide is the scope. So generally, when there's not expressed preemptive language or there's not a clear indication of legislative intent, courts should try to find a way to allow laws that aren't in direct conflict to coexist, but that's not always how it works out. And unfortunately, that area of uncertainty ends up having a really chilling effect on local governments, because the only way to really learn whether there is preemption and what the scope is to, adopt a law and then get sued. Yes, and that we know that the industries that have the most vested interest are litigious, and so that there's a likelihood there's going to be a lawsuit. And we have seen some cases where the legal precedent was more than a little bit head scratching and much broader than we would have ever imagined. So there is it ends up chilling a lot of local activity, because nobody really wants this to get sued, of course. One example of that was in the state of Wisconsin. This was a law in the mid 80s that Wisconsin had a law that basically preempted local activity for minimum legal sale age of tobacco products, so purchases by minors and sales to minors. The city of Fond du Lac enacted an ordinance restricting self-service displays of tobacco products, which seemed to be outside of the authority of the preemptive language and of the preemptive law. Unfortunately, the Wisconsin Court of Appeals kind of tied together a couple different laws and pulling in the state tax law in addition to the minor purchase law, and said, kind of putting these together, there was a requirement that there would be a uniform standard of tobacco, basically of the distribution of tobacco products, and so that it essentially restricted all local regulation that related to tobacco distribution in the state. And this was this was a number of years ago, and so for the last 20 years or so, the state has been restricted from local activity in the area of point of sale policy, which was much broader than we would have read the law. So how did this all get started? It was in the halcyon days of the 1980s in Florida, where the tobacco industry was sitting on the beaches trying to think about how they could continue to sell their products. And they were realizing that as there was more movement toward smoke-free laws, that if there were fewer places where people could smoke, then it was necessarily going to probably reduce the number of tobacco products that are going to be sold, and it was going to have an effect on their bottom line. So they used Florida really as their litmus test. And this was before Florida had a Clean Indoor Air Act implemented, but they enacted this preemptive law that said that local communities in Florida could not regulate smoking. And this has been on the books, since then. So for the last however many years that is, 33 years or so, local communities have been preempted in Florida. And so in the meantime, Florida enacted a Clean Indoor Air Act. And so this became part of that. And there was even some litigation whether that then only restricted the regulation of smoking indoors, so that whether communities could restrict it on beaches, and the court said no, that this was broad enough to restrict all regulation of smoking. So it's really had a very a strongly preemptive effect in Florida, and it was probably more successful than the industry would have even hoped, and that led to this proliferation of preemptive laws between the 80s and the 1990s, where we saw the number of states with smoke-free preemptive laws increase from 7 to 17. We saw states with, the next kind of area was at the point of sale, and there weren't many of those on the books at the time, and those increased from 1 to 22. So we saw a huge movement toward getting these preemptive laws on the books, which we know are very, very difficult to remove once they're there.
It's become a best practice to work on tobacco control and heal policy at the local level. And when preemption enters into the scene, that can really stall momentum. We've seen this in states like Tennessee and Oklahoma when it comes to smoke-free protections. And we know that when a bad state law or a law with loopholes is passed, it can be very difficult to overturn it at the state level. I think the average now is going on more than 20 years to go back and fix a bad state law. And when you have the local option taken away to kind of chip away at those loopholes, it makes it really difficult. And for these reasons, most tobacco control coalitions or campaigns now view preemption as a deal breaker or a walk away point.
Whoops, got a little ahead of myself there. So as Cathy is talking about or mentioned, there's definitely been an evolution in the understanding about preemption and how to approach it in tobacco control. And healthy eating advocates have been paying attention. And many of you, if you work in healthy eating, you've come from the tobacco control world. So we've learned a lot from that experience, including about preemption. But of course, there's always more to learn. And are seeing in the healthy eating world that we need to be just as prepared, if not more so, in our work because of some of the dynamics around food and how people feel about food, and the fact that there's some very strong, powerful, well-heeled industry interests involved, and the idea that food is a very personal decision. What we choose to eat is a very intimate decision, often related to culture and having emotional impacts. And so this really makes a lot of our work sort of more vulnerable to being seen as, paternalistic, inappropriately paternalistic, that we're interfering with free choice, and therefore that preemption is an appropriate response to those efforts. And so here, some of you might have seen this picture before, but this is former Mayor Bloomberg dressed up as Mrs. Doubtfire, a national nanny, trying to tell people, be the food police and tell people what they can and cannot eat. And, it's important to remember, though, that these kind of nanny state characterizations are really not new to public health at all. In fact, we've been dealing with them for literally decades, over 100 years. This is an example from a London Times editorial back in the 1850s, lambasting public health people for trying to prevent cholera. And I'm sorry, the quote got a little bit cut off there, but I think you can get the gist and the tone of the complaint. So really, this is just like nothing new. So now I want to talk a little bit give you an example for those of you who are maybe not as familiar with the healthy eating world of how preemption has played out already here in our work, and some of the lessons that we've already are learning about dealing and thinking about preemption. And so this example is from the menu labeling world. So, menu labeling is this idea that there should be some kind of calorie and nutritional information posted on menus and menu boards so that people can know what's in the food before they buy it. You may not be aware of this, but New York City passed the first menu labeling law back in 2006, when we first were starting to really have a lot of conversation across the country about the crisis of unhealthy weights of children, and the fact that we're seeing the first generation of children who are likely to have shorter lifespans than their parents. And so many communities were looking for ways to help address this crisis, and menu labeling was one of those areas that rose to the top based on some of the emerging research that was available at the time, and also based on the understanding that we've become a country that eats out a lot, and that when you think about the contribution of calories to our diet that comes from restaurant food, and then the fact that when people do eat out a lot, they do tend to eat a lot more, especially kids, and that people often underestimate how many calories or what's in their food just because they don't have the information. And so this all led those public health advocates to think about menu labeling as a way to try to address these foods. And again, this is also building off the experience with labeling in tobacco products too, and using warning labels there. So New York passed this first version of their law back in 2006 and required that all food service establishments that made calorie information available voluntarily to the public had to post it on their menus and menu boards. And so the calorie posting requirement under that first New York City law was triggered by making that voluntary statement about calories. And so what happened, of course, is then that the State Restaurant Association sued to block the law. And their challenge was based both on the First Amendment, but also on preemption, the idea that the Federal Nutrition Labeling and Education Act, which, if you may know this, really has a lot to do with the Nutrition Facts Panel and packaged food labeling, but claiming that that law also preempted New York City's law, because New York City's law was based on triggered by the restaurant making a voluntary claim. The slides are a little sticky. And so what happened was the city lost that case, because in fact, the court agreed with the Restaurant Association, and that because there was that voluntary component, it was preempted by the federal law. So what New York City did was amended its law then to remove that component and just simply made it a requirement for all chain restaurants with 15 or more locations nationwide that they had to provide the information. Well, of course, that did not satisfy the restaurant industry, and so they went ahead and sued again, challenging the law, but this time the court agreed with the city, they'd fixed the law, and so that there was no preemption. Now, while all this was happening, we see that New York City was actually at the forefront of a wave of local and state jurisdictions that were starting to consider and pass menu labeling laws. And this is a map that's taken from the Center for Science in the Public Interest, just showing the growth of laws that were passed and in the pipeline between 2003 and 2009. And so as you see more local and state jurisdictions were passing laws, then national public health advocates really saw this as an opportunity to leverage this momentum to push for a federal law. But of course, the response to this effort from the restaurant industry, they could see the writing on the wall that this was happening. So of course, what they ended up pushing for was preemption. And the result is that in the Affordable Care Act, which was passed in 2010, there's a provision, Section 4205, that establishes a federal menu labeling law that requires calories to be disclosed on menus for chain restaurants with 20 or more locations nationwide, and then also requires other nutritional information to be made available to consumers upon request, but then also includes preemption of state and local laws. Now, the preemption is not complete or total. There are some key exceptions highlighted here. States or localities can request a waiver to have laws that do more. They can also pass laws that have identical requirements, and they can still pass laws that relate to warnings about food safety or the safety of a component of a food. Now, this compromise in some public health circles was viewed sort of favorably because it was seen as establishing menu labeling in places where laws were thought to be unlikely to pass otherwise. But the trade-off, of course, was that many of the laws that had already passed or that were in the pipeline were stronger than this federal law. And so that was the sacrifice that was made, was a stronger law, stronger sets of laws in some jurisdictions for what was seen as more complete coverage. But now this was back to 2010, right? Here we are in 2018, and now we can kind of look back and see, well, how has this actually played out? Well, some states have tried to or localities and states have tried to take advantage of some of those carve-outs in that preemption provision. So Philadelphia, which passed a menu labeling law prior to the federal law, but which went beyond federal law, has asked for a waiver. They actually have narrowed their law to just wanting to put sodium in addition to calories on their menu boards because of research and data showing that hypertension and other chronic diseases associated with high sodium consumption are a particular problem for many populations in Philadelphia. Well, the result is they're still waiting. There has been, the FDA just keeps saying we're looking at it, and there's been no action on this waiver request. Similarly, kind of a similar situation with that identical requirements carve out. So New York City and other jurisdictions that have laws on the books have been kind of waiting, now that the federal law is there, waiting for enforcement to happen before they really start pushing their laws. But after waiting 7 years, New York City decided that they were tired of waiting and that they were going to go ahead and enforce their own law, because that's really one of the benefits of why would you pass your own law if there is a federal law, as well, because you can enforce your own law. You don't have to wait for a federal agency or some other group to enforce it for you. You can go ahead and do it. Well, this hasn't worked out, though, quite as we had hoped. So they announced they were going to go ahead and move ahead with enforcing their law. And then, of course, the industry response was to sue the state, alleging that even the enforcement date of the law is preempted by the federal regulations, and so that localities can't enforce their own laws until the federal government is enforcing its law. And kind of the killer of this is that the FDA actually weighed in on the side of the industry groups and agreed that, urged the court to find that their enforcement date was also preemptive. This means that as a result, New York City has agreed to wait until May 2018, which is when the FDA now says that they are going to issue guidance and keep on a path to actually requiring compliance with the law. And so we're here again in wait and see mode, seeing what will happen. And then finally, on that safety a carve out here, New York City, again, leading the way, adopted a law that requires chain restaurants with 15 or more locations to post on their menus boards this little sodium shaker icon to let people know that this is an item that has a really high sodium content, and to provide also information, an anchor statement helping educating people about that, really the maximum intake recommended for the typical American or average healthy American would be 2,300 milligrams. And so this law, they passed this law, and again, familiar story here. The response from industry has been to sue to challenge it, claiming that it was preempted. But here, so far, we've got a more of a positive story that the city has been successful. The law has been, the courts so far have upheld this law and have found it not to be preempted by the federal menu labeling law. And so far so good there. And so we know that, there's other localities too who are interested and who may be taking similar approaches, and we'll just have to see what happens. So that's just kind of a snapshot of, one type of food policy work and the story of preemption there. And I hope you saw that it gets come up multiple times, pretty much at every turn. And, I think that's to be expected. And this is a map here just showing, though, that it's not just limited to, menu labeling, that there are, or to the federal law, that there are several states, about a dozen since 2008, that have passed some kind of law preempting some kind of healthy eating policy work. And so those cover topics from whether it's menu labeling or it's like healthy kids meals, or not saying localities can't regulate soda serving sizes. It runs the gamut in those states that have that red circle on them. The purple dot there, I just have that there because that's kind of showing a new trend. Cathy mentioned, this talked about some efforts to preempt local authority over soda taxes. And so while many states already say that local governments can't pass taxes or limit their taxing authority in many ways, what we're seeing is a movement focused specifically on soda taxes or sugary drink taxes, and trying to limit or take away local authority to tax those items specifically. And that law, Michigan, was passed last fall, and again, we expect to see more coming down the pike. I have X's over California and Ohio, just because those are two states that have had preemptive laws, but they've either been, in the case of California, their menu labeling preemptive law sunsetted, so it's no longer on the books. And in Ohio, the city of Cleveland actually challenged the law and won at the appellate level a decision that said that the state preemptive law there was actually violated the state home rule amendment. And so, that law is really on shaky ground there too. I wanted to say just a little bit more about the preemptive laws, though, that passed first in Ohio, and then a very similar law in Mississippi, and then in Kansas last year. This is a law that has since Ohio adopted it, has become a bill, an ALEC, the American Legislative Exchange Service, a model bill for ALEC. And, again, ALEC it sounds like a sort of neutral think tank kind of policy group, but really it's a way of allowing legislators, connecting industry interests with legislators, and they have a lot of model bills that have been really bad for public health. And one of the bills is this kitchen sink preemptive health bill focused on food policy work, which tries to preempt everything from menu labeling to healthy kids meals to soda sizes to almost any effort by a local government to regulate a food retail establishment or food service operation. And this language that I've highlighted here is particularly troubling because of it purports to take away local authority to regulate these kinds of establishments based upon the existence or non-existence of food-based health disparities. And again, in the public health world, we know what health disparities are and how they're connected to food. And so the idea that this kind of language would be in a law and would essentially help to entrench and perpetuate systemic inequities is just pretty horrifying. So that just kind of takes us up to just thinking about, okay, we're seeing this kind of new phase in preemption, very aggressive preemption, and Mark is going to talk more about how that's shaping up.
I guess I'd like to start off just by emphasizing what Julie just talked about, the important role that ALEC has played in the proliferation of all of these preemptive laws. I think it's hard to overstate their role in this and getting legislators together and drafting model policies.
Can I say they're also recruiting local legislators as well. I've read that on their website, so that they're even trying to, you know, get local policymakers on board with this idea that their authority should be limited, which is sort of surprising to me, but yes.
It is. So where are we now? I guess that's the question, and what does this mean for public health as we sit today? We are seeing more and more use of preemptive laws as an offensive tool by industries to mitigate or to eliminate the local public health initiatives, and this has been increasing exponentially. And Cathy probably has a much better sense of how many, but I know we are seeing hundreds of bills in the last couple of years a session that are preempting local control in all sorts of different areas. And it runs the gamut, and this is by no means comprehensive, but just to give you some kind of a broad flavor, there's been the anti-discrimination laws. North Carolina won HB 2, which got a lot of publicity, but those have been we've seen those cropping up in other states as well. I'm going to skip this next one because I think it's an important one as a change in tactics. But climate change, paid sick leave, and minimum wage laws have been very, very we've seen those spreading all over the place, restricting the ability to require employers to have paid sick leave, or for cities to increase their minimum wage. Plastic bag laws, gun control laws are in most states now around the country, and then some alcohol control, anti-fracking, anti-fracking, I think is how Julie talks about it. But these punitive laws are kind of a new thing too, and I think they're worth seeing because they are really another way to chill local activity. Where in Arizona there was a bill that would require if the Attorney General, not a court, but if the Attorney General determined that a law violated or conflicted with state law, then it would essentially reduce the money that the local government would get from the state until either the Supreme Court decided that it was okay, or they rescinded the law. So it was really a way to proactively stop any kind of law that might potentially conflict with state law. So a really powerful way to chill local activity.
Oh, marijuana. Even if your organization does not have a position on medical or recreational marijuana, I highly encourage you to take a look at and keep an eye on these marijuana bills. Every one that I have looked at includes something about the local authority, what local municipalities can and cannot do, mostly related to the sale or the use of marijuana, but that doesn't mean that it couldn't be a vehicle for further preemption. And we're beginning to deal with some unexpected consequences around medical and recreational marijuana laws. And when local authority to protect the public's health is preserved, these issues can more easily be dealt with at the local level. For example, ensuring that marijuana laws don't undermine existing tobacco control laws, such as smoke-free laws.
We are seeing all kinds of these broad laws that are couched as one thing, and then it turns out that they are something else. And this is an example from Iowa, but we've seen some similar things in other areas. This is one where it was talking about terms of employment and restricting local activity in there. But it also has a second set where it says that also any standards requirements regarding the sale or marketing of consumer merchandise can't be different from state law, which is extraordinarily broad and it will preempt all sorts of local activity. So really certainly it's important to keep your eyes peeled for these kinds of things that are often not in the area of law where you might be expecting them to be.
Iowa is my home state. This is Cathy again. So I feel like I can talk about it. On first glance, we just thought this bill was about preempting local minimum wage laws. We started feeling like it could be broader than that. We asked around. We were really concerned how this would impact our tobacco control laws. And turns out Altria and tobacco retailers had registered in support of the bill. And we also have 2 Iowa legislators who are on the current board of ALEC, including our Speaker of the House. So that should have been a telling sign as well. And once the law passed, and you can click to the next slide, this website published this story about from the perspective of cigars and tobacco products. And it basically, this article says that this would include a city trying to raise the minimum age to purchase tobacco or other restrictions on flavored tobacco products. So it's definitely the tobacco industry's interpretation that this law is very broadly preemptive. So what we need to do is look everywhere, absolutely everywhere, on every bill that covers issues that you are dealing with, other public health bills, bills related to local government powers or funding of local governments, and appropriation bills. We can't be too broad in what we are looking for.
And there are certain kind of buzzwords that we see a lot in preemptive laws, and this is a list of some of them that we see in a lot of places. But I would really strongly encourage you, if there's any question at all, because we know that it's an industry that's constantly changing, to contact an attorney, to contact us, and or contact Cathy, and have somebody just review it, because I do think it's important to look at these as early on as possible and to see what we think the potential effects could be.
It's so important to be prepared for preemption. It can come up certainly when we have a lot of local activity. The state of West Virginia, for example, has nearly 92% of their population protected by a local smoke-free policy. And so this bill is currently pending in West Virginia that would make local boards of health get approval from their community commissions or their county commissions. We've anticipated this bill, so that's one thing that we can be prepared for. In other instances, and you can hit the next slide, and Julie mentioned this law that passed in Kansas, and this is a wonderful publication from the Public Health Law Center that really goes into detail about what this law does. So I would encourage you to take a look at it. But there wasn't necessarily a lot of local sugary drink taxes happening in Kansas or other real aggressive positive public health policies at the local level. So we need to, even if you're not working on these issues, you need to be prepared. That's when the industry can sweep in and get ahead of us. And we are in a fortunate place in the HEAL environment, unlike we were with the tobacco companies. And so it's really important that we defend our ground at the local level and not let the food and beverage industries do what the tobacco industries have done to us in certain states.
The drafting of laws is always an important place to start into making sure that we head off some of these preemptive laws. And so we always encourage, even if it doesn't seem like there's any preemptive language, to have a savings clause, and there's something that really explicitly says that this is not going to preempt any local activity, that the local activity that goes beyond is perfectly okay. So this is something that I would encourage anybody who's drafting laws to include. Preemption can be added to an existing law later as well, and so to have something that this type of savings clause can be really, really effective.
It helps deal with the implied preemption concerns too.
Yep, absolutely. Thank you.
So one of the best ways to defend against preemption is to pass local ordinances. Make friends with non-traditional partners. The more, the merrier. Once these bills are introduced, they move fast. So it's really important to educate your base early on so that you can mobilize them quickly if needed. And if you're already preempted, work to repeal it. This is not an excuse for extending the preemption to include other products or provisions. For example, if you're working on Tobacco 21 or adding e-cigarettes to smoke-free laws, just as examples, make sure that the existing law that you're trying to amend is not preemptive. If it is, make repealing that preemption clause part of your campaign. Supporting bills that rely on existing statutes can imply that you support preemption, or that you wish to grow preemption over subject areas that originally were not preempted. Passing local control resolutions has been an effective strategy towards repealing preemption. This strategy can help build relationships with new partners and educate your grassroots and the public along the way. And just would note that messaging is really important. Unfortunately, we've seen opt-out provisions in conjunction with statewide smoke-free bills in several states. So basically, if the community were to, by a vote of the people, decided they didn't want to be smoke-free, they could just take a vote on it and opt out. Clearly not what we want from local control. State law should set the floor, not the ceiling.
Well, we have reached the end of our formal presentations of information, and know we've thrown a lot of information at you, and so if you're relatively new to this topic, it may seem a bit overwhelming, but we all want you to know that there are other resources out there. I mean, we have, as Mark mentioned, and Andrew, we have a lot of resources on our website. ACS CAN has resources. American Heart Association is really paying attention. This has resources. Grassroots Change, all these organizations listed here. We encourage you also to view people like us and the folks who work for these organizations as also resources that you can reach out to and ask for help, get more information from. And so it's a complicated area, but once you kind of get familiar with it, you can come up with strategies, and we're all really excited and wanting to help. Now I think we're going to turn it over for questions.
I just want to mention one other thing. We're updating some of our preemption publications that should be available for the next couple of weeks. So I encourage you to stop back to our website to check those out, because they should be very exciting.
Thank you, our wonderful presenters, for the illuminating discussion on the topic of preemption, which I personally always find intriguing and very disturbing at the same time. We have a couple questions here, and others I think are still trickling in. This one is more general on preemption. Is preemption ever a good thing? I guess you guys can all discuss it. It's not really directed to any particular person.
Well, I think there's, sometimes you hear about like preemption and the idea that we have federal civil rights laws, and those in a sense preempt state or localities from providing less civil rights to people than what is required by federal law. And so in that kind of a case, preemption is a good thing. And I think one, it's from a lawyer standpoint, I'm not sure if that's so much about preemption as just sort of the idea that you can't have it's a sort of a federalist principle, right? And so the law can set a higher level government can set a minimum standard, and that's just the way our government works. And the idea of preemption is more of the ceiling preemption, where if the higher level government is actually capping what the lower level government, not only setting the floor a minimum, but also capping it, setting a ceiling, that's when it's bad. And I would say, from the public health perspective, that it's really, I'm not sure that we could ever say that ceiling preemption is a good thing, and because for me, I always think about it as being that, like, you're sacrificing the future for a short-term win. Back in the 70s and 80s, getting a smoke-free law that set smoking zones and non-smoking zones in restaurants seemed like a huge win. Okay, we're willing to trade preemption for that because that's a huge win. And now, of course, we know how really that was nothing. That wasn't really progress. And so I think that's one of the huge hazards of preemption, is that you're trading away the future for something that seems really good, but you really don't know. And I think the jury is out on menu labeling with that. There's some, again, arguments about, well, at least it's something, but who knows? What did we give away in order to get that? Mark, do you want to add anything, or Kathy? I'll get off my soapbox.
I wholeheartedly agree with what Julie said. I think that the idea of preemption is a fundamental, foundational principle of our system of law, and there has to be a way for courts to determine if there's a conflict. But in terms of adding preemption, we usually don't think of it as an opportunity to reduce rights as being a preemption if the rights are already established at a higher level of government, at the federal level, for example. And I think we have learned, unfortunately, all too well that there is no such thing as a little bit of preemption, that it doesn't really matter how something is couched in terms of being part of a good bill. There's always the potential for litigation, which is expensive and can expand the scope of preemption in any kind of a law beyond what we would have ever imagined. So I think I'm not thinking of any good examples of where preemption would be a positive or even an okay thing. I don't know, Kathy, do you have thoughts?
No, I don't. I think you have covered it.
Thank you for that. And there's the next question coming in. And I think, Kathy, you'd probably be in a better position to answer this as it pertains to what's going on the ground, especially this session, what you're seeing in lines of in terms of preemption in this session coming up legislative session.
I think we are, we're seeing a few bills here and there. I think we are anticipating quite a few more. It's been a little bit quiet on the preemption front, but I tend to be prepared for the worst. So I'm sure we will see more as sessions continue.
Here's another question, and I think this is somewhat related to preemption, but somebody's wants to know more about the relationship between preemption and Dillon's rule.
Mark?
It's getting passed over to me. Yes, I'll try to handle that. No, it's a really good question. I think it's an important distinction because I do think those issues get conflated. Dillon's rule is this, it's this theory that was established by a federal judge and it turns out that all three of our panelists, and Andrew is sort of a part-time Iowan, are from Iowa, but he was a federal judge in Iowa who said that basically that local governments only have that authority which is explicitly granted to them. And so it works kind of like preemption, but it's an authority issue that certain states, a majority of states have operate under this theory that local governments only have powers that are expressly granted to them by the state government. So if the state is silent on that, on a particular issue, then the local government wouldn't have authority. And it's a question that you certainly want to explore. It kind of gets into the question, if in states with home rule authority where it really mirrors state law, it's typically not an issue. But in some states, it really can be unfortunately a restrictive way, a severe restriction on what they can do. So again, it's a little bit different from preemption, but they all kind of are issues that need to be analyzed before any local laws is considered.
And Mark, you're going to try and touch on that in one of your updated publications, correct?
We are, yeah, because I do think it's a question that comes up a lot. A lot of people are understandably confused because they are so interrelated. Thanks, Kathy. That's good clarification.
Well, that's what we had for the questions, and I think we're coming to the end of this webinar. Thank you for attending, and thank you to our presenters for that wonderful discussion. Yeah, and there's somebody asking whether we can share topics for the coming webinars in the series. We have actually a mailing list where we always publish what's upcoming, and if you sign up for it on our website, you can sign up for it. Our website and our information is right on that slide that's showing right now, so you can sign up for that and you'll be receiving those updates as and when they arise. Thanks again, everyone. We appreciate your participation and your presentations. You should proudly clap for yourselves.
Thank you, everyone.